Hi everyone, this is Abhinav Bolisha. I am a third year resident from Illinois Masonic Medical Center. We are here to present you about Folfox induced pneumonitis. So, Folfox is a combination of three drugs, which include folinic acid, fluorouracil, and oxaliplatin. And this is most commonly used as a chemotherapy for cancer patients. And mostly in colon cancer, it has been used. So, as we all know, adverse effects are common for most of the cancer drugs, and pneumonitis is one such adverse effect. But literature review shows that Folfox induced pneumonitis is rare and reported less often. And when they have, the mortality rate is really high, which goes up to like 76.9%. We have such a case over here. We report a 65-year-old female with a past medical history of stage 2 colon cancer who was diagnosed recently and was planned to start on Folfox chemotherapy for 2 months. It is given every 2 weeks and it is, I think, 6 cycles. We have this patient has received about 3 cycles, and during the fourth cycle, she started to have complaints of dyspnea. During the last 3 cycles, patient did have a few adverse effects, mainly anorexia and nausea, which is not mostly expected, but it was easily tolerated, and they continued with the chemotherapy. And during the fourth cycle of the chemotherapy, patient developed dyspnea, and especially on exertion, and she went to the clinic and she was further referred to the ED for further management. And in the ED, they got a chest X-ray and CT scan, which shows extensive ground glass opacities and consolidative opacities scattered throughout the lung, most prominent within the right lung. Which it was non-specific, and they suggested it could be either inflammatory or infectious process. And at the time, we ruled out mostly the infections and also the metastasis, and then we started to treat her as a inflammatory for the inflammatory disease by giving solumedrol 40 QID. But during the she was in the hospital for nearly 27 days, and throughout her course her oxygen saturation kept going up. She was initially on like a nasal cannula with about 4 to 5 liters. She was later put on high flow, and she was never out of high flow. And we further opted to go and do a bronchoscopy, and biopsy procedure was performed, and biopsy confirmed pneumonitis and negative for atypical cells or malignancy. And during that time, patient had a complication of little extensive bleeding after the bronchoscopy, and later on she was admitted to the ICU, intubated and extubated, and but she was never out of high flow nasal cannula. Um, a repeat CT scan after 15 days showed interval increased patchy ground glass opacities throughout the lungs, suspicious for worsening inflammatory process. And during that time, she was completely out, and the family made an option to make her a hospice. So it is, as a discussion, we would like to mention it is a rare side effect, and when it is present, it is often fatal. I mean, there are sometimes mild symptoms. Most of the times, the treatment is through steroids, And there are also case reports where there are steroid resistance pneumonitis was also seen in a few cases, and other adverse effects also include interstitial lung disease, pulmonary fibrosis, and most of the patients were seen to have a median of 10 cycles. At least 10 cycles were given before they developed the lung toxicity. This is very important for a clinician to understand the adverse effects of the Folfox before it has been started, and also monitor for the uh, lung toxicity moving forward while getting the chemotherapy. That is about that. Thank you so much.